and we presented what really causes this, and they at the community level, based on really the recommendations that came from session number, was it 10? And we also made a recommendation that as we do this national level surveys, we may need to make a recommendation for indicators for some of those, because when you asked in the morning, is there anyone who has the national prevalence data for virginity testing? We do not have that. Same thing for forced male circumcision, girl child breeding, and things like those. So there's what we need to do, such that we know the magnitude and the scope. So thank you so much, Dr. Lumbe. And I know there's is it Joy? Joy? Is Joy back? We wanted Joy to take like 2 minutes and talk to us. There's someone who wanted to understand virginity testing. And maybe some of them have heard about this for the first time in this meeting. So when she comes in, she will talk about it. You wanted to comment something similar to her? Okay, so let's start with.
Good afternoon.
Afternoon.
My name is Samuel Ngitoria. I work with Pledge for Progress in Kajiado County. So just wanted to put a comment. I wanted to make it yesterday, but there was no time, especially for the young people. I heard the young people, they are coming up with innovations and new strategies, but they want to be recruited in our own strategies, and they want to continue with the way we are doing things. But I will want to urge the young people, especially those who are coming up in this space, to be more innovative. Let us support innovation, because there is a lot of innovative approaches that can solve problems. The problems of data, the problems of different kind of interventions we are doing in the community. Let us help young people to explore new ideas of how to do things. Number 2, there is this issue of online safety. Let us not assume we are dealing with children who don't have access to technology, even at the grassroots. Most of the modern smartphones have penetrated even the grassroots level. And the young kids as young as 4 years, 5 years, they can operate that mobile phone in a way you cannot even understand. Personally, my child, who is 5 years, knows a lot of things in my phone. So it means we cannot ignore the aspect of online safety, especially now that very young kids as early as 4 years, 5 years, they access these phones from the parents. And it is true, the parents, even in the lowest grassroots level, they have access to these smartphones. So let us not assume that we are living in the Stone Age, that people don't have access to mobile phones, they don't have access to technology. They do. Thank you.
Thank you so much for that. And I know what you are reminding us, not trying, because you've reminded us, is that especially on the issues around online access, usually we say in this place that most of the parents who are providing parenting to our children, there is that, it's called what? The divide in terms of like the parents are digital migrants who are parenting digital natives. And so because of that, the divide, it becomes very not so easy to provide that kind of a guidance. And so there is also kind of empowerment that needs to go to caregivers to get to a point where you're providing guidance to a child to use the online environment safely, as opposed to blocking them from accessing those environments. So thank you so much for that. And of course, what you talked about in terms of youth, empowering them and supporting the innovations, very important. Something I wanted to quickly highlight is what the session by the donors, where they talked about the ecosystem approach in terms of programming. I'd want to again recommend that take time to understand what that means in your programming, because the ecosystem approach means as you're targeting the child, this child has got their own needs. Then the child lives in a family, the child lives in a community, the child is surrounded by institutions, and there's a system. So affecting all those environments is what really summarizes the ecosystem approach, and that is what will contribute to sustainability. And there's something else they talked about, systemic change approach, shifting from funding projects to funding or investing in systemic change programming. And what that really simply means in English is that you understanding the root causes of a particular problem and the interventions are working towards addressing the root causes, so that we can talk about sustainable transformation. So thank you so that even as we support the young people, we need to also support them to think in those lines. Yes.
Good afternoon.
Good afternoon.
My name is Langat Nelly. Mine is to emphasize on, as we come to the close of this, I hope that this conversation does not end here. We'll even take back to our other organizations that maybe they didn't even have time to come here. Another thing, as you are aware that most of these harmful practices often happen to people with disability, the kids to be specific. So even as you tailor your interventions in the community, are you doing activities that make sure that people with disability are included? Do you have sign languages in those sensitization or awareness creation conferences that you have? So moving forward, we need to make sure that all the interventions that we are doing are actually inclusive. Thank you.
Thank you so much. And then the last comment here, then we go to the questions. For the question, guys, you first mentioned the moderator that you are targeting with your question.
Thank you so much. I had said my name. Yeah, my recommendation, I have 3 recommendations. And one, I recommend if a proper sensitization can be done, and especially on issues of children hurt in the communities, because with the experience of interacting with the people in the community, many people doesn't understand what is in that document for children hurt. It has to be sensitized well for everyone to understand, and also about the FGM hurt, GBV prevention and response, and also the issues of SOS, sexual offenses hurt. That thing has to be clear to the community so that they can be able to understand also the report of pathways, so that we can be able to minimize the cases of GBV and any kind of harmful practices affecting our children in the society. Then the other thing, proper collaboration with the relevant departments that handles matters about children has to be strengthened, because I know there is a collaboration. For example, I was talking about mental health issues. I know it's a docket that belongs to Minister of Health, but also there are relevant departments that has to come in to collaborate, so that they can be able to strengthen, so that we can be able to deal with the behavior challenges, and for the interest of behavior modification with our children and the coming generation, the teenagers and also the youth. That one will also help the parents also to improve in parenting skills, because I wish we can practice what Uganda is doing. Uganda is doing something they call community parenting, and they call it Better Parenting Plus. And it is really helping the society in Uganda. I wish Kenya we can also practice that, so that we can be able also to enlighten the young parents on how to parent the children, and also to monitor their behavior, and also practice on parenting for respectability.
Thank you.
Thank you so much.
Thank you. Thank you so much.
The other thing is about, let us also deal with the contributing factors to these harmful practices.
Thank you.
Because we have not talked about issues of drugs, which is one of the contributing factors, the mental health, disabilities, and other things that are contributing to harmful practices. Thank you.
Thank you so much. Again, a very good reminder, even as we deal with the root causes, we also need to look at the enabling factors as we do programming. So thank you so much. We now need to go to the questions, people. We are done. Those of us who have come late, is it late? Early for the next session. We have mapped the people who are to give comments. We are done with the comments. So now we are going to those who are asking questions. So please direct your question to any of the panelists that we had from since morning. And as I give you the mic, go straight to the question, such that you also save on time. So let's start with Madam there, then we go, I think there are about 3 questions.
Good afternoon.
Good afternoon.
My question, I would like it to be answered by Mogore. First, on the intersex, what Frank addressed. if there is a Children Protection Act protecting these children, and at what, who chooses the sex when the surgery correction is done? Is it the parent, the child, or it can be guided by a children's officer who can advise on such? Two, we talked of so many harmful practices. I had some speakers mention forced male circumcision. I want to get a clarity from somebody from Migori, Kuria, or Kisumu, because most of the times we are told, Wajaluo, Ninya Mujakata. Sasa, on the other end, when our children go to school, they get bullied, and they have to do this male circumcision. And on this other end, they get bullied. So which one is which? Can we get a good clarity on this? Thank you.
All right. Yeah. So I said 3 questions. Wait, the second question was which one? Yes, Njambi. Then we go to the last one there.
So thank you. My name is Njambi Monga from Chala in Kenya. So my question would go to Frankie and maybe to the MOH on whether we have birth notifications for intersex persons that, according to my view, it would help especially in avoiding the mutilation being done earlier and giving it more time. And also, Frankie, I think he had mentioned about the birth certificate issue, which could also help them be given a period of time where they can take the birth certificates way later in life. Thank you.
All right, thank you. So, Frankie, are you in the building? No, he left. So Esther, you will. Then the final question there. There are some colleagues who are leaving at 3, and we need to conclude on the questions so that we do the next activity. So if we create time after that for any question, we will do that. Yes, please go ahead.
Mine is directed to CIF and UNICEF. With the shrinking funding space globally, is there opportunity for us to maybe bring the issues of harmful cultural practices to the table so that we can there can be global prioritization of resourcing for this particular subject matter? The second one is I am directing to KNHCR and any other organizations here that are working on issues of access to justice. Is there opportunity to create accountability for the court process to maybe pass, I don't know, discipline or anything on these other forms of harmful cultural practices, especially the ones that are mentioned within the Act? For example, we know when a child is married at maybe ages 0 to 15, when they go to court, this is the maximum number of years they can get. Right. What about if I was to report bidding? The court might not have what to do. Can organizations that are in litigation, in legal, and organizations like KNHCR kindly start working on those so that by the time we get to access to justice, there's something to work from? Thank you.
Thank you so much. Let's first take those ones, please, in the interest of time. So let's give Esther. Esther, do you want to respond to the intersex question? There were 2 of them. Who determines, and the issue around birth certificates, before we go to UNICEF and CIF.
Okay, thank you. Sorry, let me come here. In terms of the question on intersex and whether there are laws, I had written that question. I think I was doing a few things. So we have the Children's Act. The Children's Act talks about, apart from intersex genital mutilation being a harmful practices, it also has key rights and that intersex children should have. And maybe just check within the Children's Act and see what the law says. So in terms of the birth certificates, that one, Jackson, can I give you that to respond? Yes, please help me.
Actually, our government has now introduced the third gender in the birth certificate, the
Yes.
I.
Mhm.
Yes, so that one I can confirm.
Okay.
Yes.
Great, thank you. Then somebody had also asked about data from related to harmful practices on boys. Remember the presentation that I did yesterday on programming data and the fact that our data of harmful practices is not okay, it's fragmented. What we have is just that for boys, we know, and I'll just quote for child marriage, it's a 3%. You ingine FGM, if boys don't undergo FGM, then in terms of virginity testing, it's for girls. Forced male circumcision, we don't have that data. Somebody mentioned that in the morning. Then in terms of clear pathways for reporting child abuse, mainly as a State Department for Children's Services, it's 116. 116, that's the easiest, the most easiest route, because it's a toll-free number and you can call from anywhere. What was the other question? Yeah, and I'm done.
Yeah, that is it. So let's appreciate Esther. Thank you so much. Let's have UNICEF respond to the question that I hope you wrote that particular question. As before that, Joy, I want to give you 46 seconds to highlight about virginity testing. There's someone who asked that question, what exactly is that practice? Are you in a position to? 46 seconds. Are you in a position to? All right, no problem. Is there anyone who can respond to the question on forced male circumcision? All right. Again, it's because there is no data, but I think those are questions that we can pick. And then when Esther will be sharing the key learnings from this particular meeting, we could also try to provide responses to some of the questions that maybe that we don't have responses to at this point in time. Then Madam Janet, the question that was talking about opportunities for accountability, especially in the court processes, litigation on some of these practices that we don't even have data on, especially like girl-child billing and things like those.
As I said, the Commission has a whole department on redress. That is where you find lawyers who will follow up your case and actually be able to speak on your behalf. Remember, children are vulnerable. They may not be able to speak on their own, even when they appear in court. So when you visit KNCHR, and we have very many offices in different places in the country, you will be helped. And then for cases this about this, and maybe the ones that are not very famous, like bidding, you realize that bidding is only done by a very small section in the country. But then again, it's a harmful practice, because when I read about bidding, the things that come after bidding, they are actually against the rights of a girl. So I can say that the Commission is there and it will help in such cases. That bidding is torture. That is torture. It's discrimination. Yeah, so it is there, even though it has not been captured. Like for the FGM, see FGM, we have the FGM Act. So maybe you can say we don't have the bidding act, but it is an harmful practice. It is a torture to girls. Thank you.
All right, thank you so much. Just a reminder that, of course, much as we don't have specific acts for those four that we talked about in the morning, they are still recognized in the Children's Act. So now the conversation should be, how do we make them harmful practices that we need to be talking about even as we engage in our interventions. I will delay the question that Jack needs to respond to, because the lady has documented it, such that you continue interpreting it. I invite Esther, because I know there are colleagues who are leaving in the next few minutes, to do some short session, and then remember to create 1 minute for Jack to respond to the question. So thank you so much, and back to Esther.
Thank you. Let's appreciate him. Yes, thank you. Jack, as you'll be doing your closing remarks, we'll give you a few minutes. Just before you do your remarks, you respond to that question. So we've been here for the last 2.5 days, or 3 days, and quite a lot has come out from this learning convening. So we've reflected, because I've had from the presentations and even from this in the afternoon, we've heard of some of the reflections regarding this learning convening. But I would like to give like 2-3 people to tell us, what is the takeaway from this? What did you learn from this convening? Any key thing that you learned from this convening? Very quickly. And if I don't see new hands, Jack, we've not learned anything. Yes, what have we learned? Yes.
What I was able to learn for the last few days we have been here is that it's very, very, very important to have a proper referral pathway from all sectors who handles matters of children.
Thank you. Thank you. Any other key learning? Yes, Abdi?
One of the key learning
Yes.
is about the community gatekeepers.
Yes.
Should have an increased awareness and also understanding the in-depth effects of harmful cultural practices.
Okay. The last people, as I call the 2 children here to come and give us their reflection. Please come and just sit over there. The last person. All right. For me, I learned that declarations, unless followed up, do not work. There are so many things that we learned, and I think the key things, we will be able to develop or to generate a report regarding this, and we'll be able to share with you, and this will document all the key things that have we've seen work and others that do not work. And at this point, I want to welcome this young gentleman to give us his reflection regarding the convening.
So, is it an afternoon? Yeah.
Yes.
Good afternoon, everybody. Good afternoon. Everybody has taken lunch, right? Yes. So, speak like people who have eaten. Yeah. Good afternoon. As I am Sami from Kiambu, brought here by an organization called ICS, representing the children of Kiambu. So if you wondered how much I know about those cults, I'm a Kikuyu, you have heard. I'm from Kiambu, I'm called Kiarie. And I'll share my remarks, I'll not take a lot of time, but just say what I've learned here. And the most important thing I learned here is that it needs commitment, and it takes commitment to stop these harmful norms and to accelerate in stopping these harmful practices. Like we know, kidole kimoja kivunji, we know that, right? So it needs commitment and teamwork so we can stop harmful practices. That is very important. And also, I'm going to reflect on what the panelism here of the youth was about. We need to involve them. Because, not in the future, but in the coming days, I'll be a youth too. Yes, I'll be a youth too. And what they addressed here is very important. They need to be given their own time, their own spaces, we can account, we should have accountability on them. We should believe in them. It is just the way, you see, they were placed here as professionals, but when it comes to meetings that include money, that the government usually say they don't know how to use money, the youth, isn't it? But when it comes to those meetings, they actually say, the people that are taken there, they say they are not professionals. But the people we had here talking, they are very great people. So if they are included in those meetings, we can see there will be change, yes, and that is my reflection.
Hi everyone. Yes, so you still remember, I'm Jerry from Kiambu, the same organization with Sami. We study in the same school. So I have my remarks for the past few days that we have been in this learning convening. So what I'd like to appreciate is for your cooperation and your congratulations to Sami, helping him, even motivating him to know about the cults. So that was very nice of you. You are very supportive. So I've learned a lot about this convention. Many, if I start saying them now, I won't finish. So we have many cases. We've talked about FGM, we've talked about child marriage, but my focus was on FGM. So if you want to know FGM, everyone do this. Do this. Here. Do this. This is FGM in sign language. I'm very interested in sign language. So I've learned a lot about FGM through the convention, and I'm thankful for all the panelists, especially Christine. Christine Monyau was very bold and confident about what she was saying and the refugee. So about the FGM, I know we have many government protocols. Esther, one of them. So we have talked about the acts. I've had Act 2022, Act 2011, Act 2006, but I've had implementation. That was our new word, but at least I'll understand it later. Okay. So the implementation, I think that's carrying out. Is that carrying out? Yes, so the implementation of those acts, I think, Esther, you'll promise us that you're going to implement.
Luckily, our secretary is with us, so he may be able to respond to that.
Yes. So the man drinking water, are you going to? So you're promising that. Everyone is my witness. Everyone is my witness. Yes, so that's all I learned, but that's not all. I have many. So that's all I'll say for now because of time. But next time, maybe I'll be able to say more. So everyone do this. Thank you.
Thank you so much.
I've just said what I learned, but did I teach something? Did I, because I was here in the panelists, did I teach something? So I went home, learned, and I went home, learned, and I taught somebody, right? Yes, thank you.
Thank you. The team, let's appreciate them in a better way. Yes, thank you. So the next session is the way forward. We've had this convening. So what next? What next? And I want it to come from you. What should happen next? Let's hear. Yes, my moderator helped. And we make it short and, there was a presenter who was saying short and sweet, yes.